Hi, welcome to News Explained. This is your sister Sheba on the topic why there is a delay in finding a medicine for corona. You would think about why there is a delay in finding a medicine for coronavirus. What happened to the tall claims of science and medicine? We can investigate if there is life on Mars or perform riskiest surgeries like remove half of the child's brain or weight loss operation. Then what is the uproar on creating medicine for cold and flu? Ironically, this is not just a cold and flu. Although it starts with such commonplace symptoms, lockdown could be an answer to contain the virus. But do you know only lockdown and social distancing won't win the battle? Medicine will. We probably would think all it needs is money to make the medicine. In reality, banknotes alone can't save the lives. Do we know about this coronavirus? Dr. Van Kerkhove from WHO clearly said that the treatment focuses on the respiratory illness symptoms and not any targeted treatment. Let us try to understand what else it takes to find a cure for this curious case. The official name for this disease is COVID-19. N for novel, CO stands for corona, VI for virus, D for disease, and 19 is 2019. The year of detection in Wuhan city in Hubei province in China. The fact that this name has a prefix novel makes it more complicated. Little information is at our disposal on this new strain of family of viruses. Only eating bats may not have triggered a pandemic of such proportion. Precisely, this is the first impediment in the efforts of finding a medicine to kill the virus. All of us thought as COVID-19 is similar to the SARS-CoV-2 virus. The same medication should follow, but unfortunately the same drug would not work. This new coronavirus is 10 times deadlier and infectious over SARS and MERS virus. We remember running around the corridors in the doctor's clinic on our frequent visit for mandatory vaccines like polio and tetanus. Now we are impatiently waiting to get the vaccine shots. If you don't know the source of the disease, making a vaccine would depend heavily on try and test formula. Research shows that the vaccine usually takes several years to develop and available in the market. Before that, it demands rigorous testing on the animal model in a safe environment. If consistently successful, the next steps ensue. The worst is not yet over. Every vaccine development goes through multiple clinical trials and phases. Now, do we have time for all this? The cases are surging up in all parts of the world while we are discussing the possibility of a cure. All this brings us to another constraint in finding medicine. We would need many patients to conduct clinical trials and store relevant test results. Extensive documentation, infrastructure support, availability of human resources, and post-approval check is the order of the day. Managing all this while trying to keep people alive and healthy is an arduous task for the governments across. Before you get disheartened, let me tell you, we are not heading towards apocalypse. The good news is that the vaccine for COVID-19 may take about 12 to 18 months as the genome sequence is 88% similar between SARS and COVID-19. Researchers feel that they can build up their research from SARS outbreak findings. While investigations are going on to understand this new virus, a lot of news is doing rounds on the usage of malaria drug called hydroxychloroquine and antibiotic called azithromycin. We don't know how these two drugs will cure COVID-19 as the latter lacks metabolic machinery. Data collected from New York and France suggests that a combination of hydrochloroquine and azithromycin worked for a few and didn't work for some. Dr. Anthony Fauci, Director of National Institute of Allergy and Infectious Diseases, has a different opinion here. He adds that our older people did not recover from this combo drug as they were more vulnerable for COVID-19 impact. The younger group healed because they would have healed anyway due to healthy immunity. In his words, it is anecdotal evidence. Because these drugs are not hard to find, we have concerns about incorrect self-medication. No one knows for sure what could be the potential side effects for the masses. The shortage of supply of these drugs is causing trouble for patients suffering from malaria and rheumatoid arthritis and lupus as well. Public health care is waiting for another hammer blow now. In its press release on Feb 5th, 2020, WHO stated, even though we may have the same virus with two different signatures, they are fundamentally the same with a slight variation. All these may baffle a common man, but what we need to remember that with collective global cooperation and comprehensive approach, all of us can throw the virus out of the door. The cure is not impossible, but it will take some time to rescue us. In the meantime, don't believe on unproven data on any medicine to act as an elixir.